I was recently asked some questions by a man from Albania. He wanted to cut through the noise, the myths, the misinformation, and understand the medical reality of what it means to be transgender. He asked some important questions, and they deserve some really clear answers. What is gender identity? Now, I know that the world has mostly categorized gender as male or female, and actually most people do fit into one of those two categories. But when you're born, a doctor looks at your body and makes a best guess, and that's what goes on your birth certificate. And if that guess matches how you come to see yourself, that's fine, cisgender. If it doesn't, there was a mistake. You're marked male, but you actually come to realize you're female, or vice versa. And that means you're transgender. How do you know if someone is transgender? That's easy. You ask them. That's it. You can't tell by looking. You can't tell from a chromosome blood test or a brain scan. Gender identity is a deeply personal sense of self, and the only person who truly knows is the person themselves. Is the treatment dangerous? Well, some transgender people choose to take hormones so that their body develops in ways that match their gender. A trans man might take testosterone, a trans woman might take estrogen, and all we're doing is replacing one hormone with the other. The same hormones that half the human population already has. Ironically, this is one of the safest treatments we know. There's a lot of public debate about puberty blockers, but medically the evidence is clear. We've been using them in children since the 80s. The American Medical Association, the American Academy of Pediatrics, the Endocrine Society, they all agree gender-affirming care is safe, effective, and medically necessary. Can you turn someone transgender? No, you can't. You can't make someone male and you can't make someone female. You can't indoctrinate a child into being transgender, and you can't force a transgender child not to be. You might be able to make them pretend, but who they are doesn't change. Gender identity isn't determined by chromosomes. Chromosomes just dictate which body parts you have and then which hormones you produce. Who you are is something much, much deeper. It's in your heart, your brain, and your sense of self. Are these research studies experimental? Well, do you know what? Medical research isn't experimental. It's essential. We follow patients over time so that we understand again and again the long-term outcomes as well as the short-term outcomes of treatments. The studies being proposed in the UK aren't testing whether puberty blockers are safe. We already know they are. They are observational studies following children and young people outcomes over years. They're not an experiment, it's just good medicine. Trans people exist, they always have, and right now they're facing real difficulties with acceptance and inclusion. Not because of who they are, but because how the world is responding to them. In the UK, gender reassignment is a protected characteristic under the Equality Act, and now we need to make sure that those protections are reality. Understanding gender diversity isn't complicated. It just starts with listening, and it starts with listening to the facts more than the fear. And it starts with recognizing that trans people, including trans young people, deserve the same dignity, the same healthcare, and the same support as everyone else.